Good morning. My name is Lisa Keeler, and I am the Program Director for Project Opioid Broward. I'm so pleased to be here today with our amazing panel of community leaders to introduce them to you and discuss Project Opioid and what we're planning to do to stop opioid and fentanyl crisis in Broward County. I hope that after you learn about some of our initiatives, that you will join our call for action and contact me. I'd now like to introduce you to Project Opioid's founder, Andrae Bailey.
Hello, everyone. Thank you so much for joining our webinar. Just want to make sure that everybody can hear me okay. Give me a wave if you can hear me. Thank you so much for joining us today. I'm Andrae Bailey. I'm the founder of Project Opioid, and we're going to be taking you through a 1-hour presentation today where we talk to you about this overdose crisis that's being fueled by fentanyl and this incredible rise in deaths in your community. But we're also going to talk to you about how Project Opioid is bringing leaders together in Broward to solve this crisis and to save lives. So we're so excited to have each of you on the webinar today. Next slide, please. So as we go through this webinar, just remember, you can put questions in the chat. You can also message Project Opioid directly if you want to, if you have any technical issues or questions. So we will be answering your questions directly if you have them during the webinar today. Next slide, please. So what is Project Opioid? Putting it simply, Project Opioid is the business, faith, and philanthropic communities coming together with government, those in education, nonprofits, healthcare, criminal justice, and others to create really a collaborative that has the ability to work on this crisis and find solutions in your community. You know, listen, we all knew there was an overdose crisis even before the pandemic, but the numbers you're going to see today are really unconscionable, and they're going to call for a response in Broward County that's bigger than we've ever seen. If you're going to have that type of a response, you've got to have the business, faith, and philanthropic communities driving it. That's why Project Opioid is here, and that's what makes it unique. Next slide, please. And when you build that coalition, it's about leaders then taking action, helping work with those who are on the front lines every day. There are nonprofit leaders, hospitals, and hospital workers, others working on this issue every single day. And what Project Opioid is here to do is to mobilize a community response and then advocate for real solutions. Next slide, please. So we're also excited because we have a Project Opioid now working in most communities around the state of Florida. Huge thank you to the Florida Blue Foundation, who have helped launch Project Opioid collaboratives in Jacksonville, Greater Tampa Bay, Miami, Palm Beach, Orlando, and now, of course, in South Florida in Broward County. So thankful to the Florida Blue Foundation, Pat Garrity, Velma, Susan, Penny Schaefer, the whole team there. Such a big thank you. We wouldn't be here without you. Thank you so much. Next slide, please. So now I want to introduce Bob Swindell, President and CEO of the Greater Fort Lauderdale Alliance. Bob is going to be heading up Project Opioid through the Alliance and has been such a great champion of so much that happens in the community. Bob, are you able to hear me?
Andrae, I can hear you fine. Thank you.
Perfect. I'm going to turn it over to you, Bob, for your remarks.
Thank you, Andrae. And again, my thanks this morning to everyone joining us for this call and this webinar. Again, my name is Bob Swindell. I'm President and CEO of the Greater Fort Lauderdale Alliance, and we are the public-private partnership for economic growth in the Greater Fort Lauderdale, Broward County area. I'm really happy this morning to introduce you all to Lisa Keeler. She's the newest member of the Alliance team, and she's going to be a dedicated project lead for Project Opioid Broward. At the Alliance, we focus on creating, attracting, expanding, and retaining high-wage jobs and capital investment in high-value targeted industries. We work to diversify our economy and strengthen the job opportunities for the residents of Broward County. Through our foundation, we support and lead initiatives to develop a more prosperous and vibrant community and improve the quality of life for our area citizens. It's through our dedication to these focus areas that we are here today. We have a very influential group of co-chairs that are leading this effort for Project Opioid Broward. And we have a longstanding partnership with United Way of Broward County. And I have to say that a few of these high-profile co-chairs would not be available to us if it wasn't for Kathleen Cannon, the CEO of United Way. People have a much easier time saying no to me than they do to Kathleen. But Kathleen and I have worked together on several projects in this community. And I look forward to having Kathleen as an important part of the leadership of this effort. The United Way brings a lot of information, and they've been working in this area for a long time. We're here today because the opioid overdoses in Broward have increased by 52% in the past 2 years. And something needs to be done to stop this tragic situation. This exponential growth of overdoses is having an impact on not only our workforce, but our companies in Broward County. During the first 6 months of 2020, deaths caused by fentanyl increased by 81%, making it the most dangerous drug in the state of Florida. Well beyond the personal tragedies that this data represents, opioid abuse also threatens the health and economic fabric of our community. The opioid epidemic has reached its addictive tentacles into all segments of society. Income levels, racial and ethnic groups, professions, and neighborhoods, they're blurred by this tragic drug that is insidiously going into our community. And it's rapidly evolving. From the more traditional pain medications to heroin, and most recently to the cheap and deadly synthetic drug fentanyl. Fentanyl is more deadly and prevalent than its predecessors, which means we have lost more lives and greater impact on the health, and it has a greater economic impact on Broward County. And this is our business. While dozens of organizations and thousands of people work on the front lines of the opioid battle, and we are grateful to their steadfast commitment to this crisis, there has never been a coalition of business, faith, and philanthropic leaders formed to educate themselves and the public on innovative solutions that could save many lives. Today, we learn more about the epidemic and what it means to our community and the call to action to fight this crisis. You're going to be here first from Rafael Vasquez. Rafael is Florida Blue's market leader for South Florida's Broward and South Palm Beach counties. Florida Blue is deeply concerned about how opioids have become a raging epidemic in our community, first through prescriptions of OxyContin and the increased use of heroin, and now the introduction of the highly deadly fentanyl, synthetic opioid, which is infiltrating all street drugs. So young people that would experiment on a drug and not think twice about it have no idea that fentanyl could be incorporated into something they're trying, that they have no idea it's in the drug. You will also hear some promising solutions. And the Alliance and United Way and other organizations, when we come together, we want to focus on solutions. So today you're going to hear about solutions from our co-chairs of this initiative and from other influential leaders in our community about the steps we take moving forward to save lives. If you have questions anytime during the program, please enter them in the chat section of the webinar, and we'll work to answer as many as we can. We will also answer any questions at the end of the soft launch. Or if you would like to volunteer to be involved, please enter your contact information in the chat or contact myself or Lisa Keeler. Hopefully 1 hour from now, we'll have motivated you to let us know how you want to join the team to reduce opioid overdoses and save lives in Broward County. To start us off, I'm pleased to introduce the market leader for Florida Blue's South Florida, Broward, and Palm Beach County markets. In this role, he is responsible for the overall performance, strategy, execution, and partnerships of the local market for Florida Blue. Prior to this, he was vice president of consumer channels, where he led the state's Florida Blue centers, telesales, and field marketing teams. Throughout his career, he has held various leadership roles, advancing sales, marketing, advancing customer experience. And prior to joining GuideWell, he has held several leadership roles at AT&T and Comcast. Ladies and gentlemen, it is my honor to introduce Rafael Vasquez. Rafael?
Thank you, Bob. And if I could get a wave that you can hear me before I get started. All right. Well, thank you, Bob, Andrae, and Lisa. And thank you to the Greater Fort Lauderdale Alliance for spearheading Broward's Project Opioid work. and all the team members across the several organizations that made today possible. My name is Rafael Vasquez. I'm Florida Blues market leader for Broward and South Palm Beach counties. I'd also like to thank all of you here with us today, whether you're in healthcare, government, policy work, or own your own business. This issue affects us all directly or indirectly. And despite a tremendous amount of work that we've done the last 5 years to address the opioid epidemic, the COVID-19 pandemic has presented a whole new challenge to those who deal with addiction. The number of those who have overdosed and died has risen since the pandemic began. Broward County has seen a heartbreaking increase in overdoses and overdose deaths linked to opioids. Last year alone, we lost 545 people here in Broward. Broward leads the state in fatal opioid overdoses, outpacing both the state and national averages. You know, the pandemic has proven to be far-reaching than just the virus itself. The collision of the pandemic and the opioid crisis has caused challenges for families and communities across our country. 25% of pandemic essential workers began using a substance in 2020. 75% of people who have used a substance before have reported using more. For years, Florida Blue has been committed to fighting this growing epidemic. In 2018, we were the first insurer in the state and one of only few across the country to stop covering highly addictive OxyContin and instead offer a safer solution. Our Florida Blue Foundation has given millions throughout the years to programs that are on the front lines of this crisis. And since at least 2017, the entire healthcare community has come together to address overprescribing of opioids by identifying abusive prescribers, and that has worked. We have seen a steep decline of 76% in the amount of prescribed opioids distributed in Florida and across the country. Prescriptions of opioids are down to historical levels, low levels, and are no longer the leading cause of most overdoses and deaths. This is a positive turn of events for those who have never used opioids before, but this action has not reduced the deaths and overdoses. So what's driving that? As Bob mentioned, the answer is fentanyl. In its legal and illegal form, it is now the leading cause of overdose deaths amongst all drugs by a wide margin. During the first 6 months of 2020, deaths caused by fentanyl increased by 81%, making it the most dangerous drug in the state of Florida. It is, as Bob mentioned, being created in the streets as fake versions of prescription drugs such as Oxy, Percocet, and Vicodin, which are the most common. Also distressing is the face of the crisis is changing. It is affecting our Black and Brown communities at a much higher level. The percentage of fatal overdoses that were attributed to Black individuals nearly doubled from 2015 to 2020. And these are the same communities that are affected by other health inequities. In addition to the human toll on our neighbors, our loved ones, this is a toll on our community as well. It's a severe drain on our resources, particularly during this pandemic. So in 2019, Florida Blue helped launch Project Opioid in Central Florida because we knew that collaboration was the only way we could move the needle. We also knew that it would take efforts from around the state to reduce addictions and deaths. So now, by expanding this program into key regions such as Broward, we are confident that through our partnerships, we will move the needle. Our goal is to reduce opioid overdoses and deaths by 50% in the next 36 months. And I'm thrilled to be here today with all of you to launch this impactful work in Broward. I am confident that through this partnership, Broward will save lives. The Broward leadership community, all of you, all of us. Opioids don't discriminate. They take lives from the rich, the poor, the Black, the white, the young, the old, executives and laborers. They destroy families, friendships, communities, and business relationships. Florida Blue remains focused on doing our part to fight this battle within communities. It's imperative that we all work together to find ways to help those in need so that they can live the lives free from the grips of addiction. I hope that all of you will join us together with Project Opioid as we become better together to help every person who is in need in our community. So thank you. And now I'll pass the stage to our good friend, Andrae Bailey. Thank you.
Thank you, Rafael. Great comments there. Boy, we could almost end the webinar right there. That was such a great summary of what's happening in your community and really how the overdose crisis, you guys have all seen this in the national news. Just the last few weeks, as Rafael was noting, overdose deaths in America rose to over 100,000 per year. And when we thought this was a crisis a few years ago, that number was at 50 or 60,000 deaths. So this is absolutely a tragedy. And we're so thankful for Florida Blue and the Florida Blue Foundation's involvement. Next slide, please. If you're going to solve this crisis, let me tell you right now, you got to have your nonprofits. You've got to have those working on the front lines every single day. Many of you on this webinar right now, you could be leading this webinar. You have so much great information and you're seeing those who are struggling every day. We've got to figure out what Project Opioid is all about, is figuring out how to get new leaders who can come alongside those working every day and have adequate resources and community solutions. That's why we're so proud to present to you our co-chairs, Lisa Lutoff-Perlo, CEO of Celebrity Cruises. She is going to be such a great leader as a part of Project Opioid. Shane Strum, you all know Shane, CEO of Broward Health, and Sheriff Gregory Toney, Broward County Sheriff. These are some of the leaders that have already signed on to be a part of Project Opioid, to partner with the team at the Greater Fort Lauderdale Alliance, Florida Blue, countless others that have signed on. But these are your co-chairs. You're going to be hearing from them over the next few months, and we're so excited to have them. Next slide, please. We're going to take just a minute to hear from one of the co-chairs right now, someone who has seen this crisis unfold as a leader in Florida. Shane Strum, President and CEO of Broward Health. We'll go ahead and advance and hear from him right now.
Hi, I'm Erica Orstad with Broward Health, and joining me today is President and CEO of Broward Health, Shane Strum. Shane, thanks for being here.
Oh, thank you, Erica. Thank you for having me here today. I'm excited about Project Opioid Broward and what we're doing for the community. I'm sorry that I couldn't be with everyone today, but I wanted to reiterate my commitment to Project Opioid Broward. And you're going to have some fascinating, great speakers today. We're going to hear and learn a lot. So I hope that you'll stay with us while we run through this interview today.
Absolutely. And with that, let's get to our first question. So, are the number of opioid overdoses in Florida decreasing, or are they continuing to rise?
Yes, unfortunately, overdoses are up. And in fact, the numbers are higher than we know. They're about up 30 to 70% for deaths. According to the 2020 interim Florida Medical Examiner report, more than 3,000 opioid-caused related deaths were reported, which is a 51% increase from 2019. Really terrible news. Last year, hospitals saw 38,000 opioid overdose emergency department visits just in Florida. And while we have identified the problem, the trend continues really to rise at an alarming rate.
All right, thanks, Shane. And fentanyl is often cited as an area of concern. Has the opioid crisis actually become a fentanyl crisis?
Actually, fentanyl is an opioid, and it has become a crisis. Illicit fentanyl that is being illegally manufactured internationally and now smuggled into the streets and here in Florida is really a key driver in the overall deaths. Some of the numbers are staggering. It's actually killing 80 to 90% of those people. However, it is not prescribed as an opioid. It is a synthetic and often 30 to 50 times stronger than heroin.
Wow.
So yeah, absolutely dangerous and horrible. It's being illegally pressed into other drugs because fentanyl can be made very inexpensively. and it's making other drugs more powerful at a lower cost.
That's a great summary on synthetic fentanyl, but how does that translate to the prescription pill crisis?
Well, good question, because actually the irony of our current situation is the opioid use and others are actually dramatically down. But yet overdoses are up significantly. You're hearing about that and seeing it. Just this September, the American Medical Association released a report that showed an almost 45% decrease in opioid prescriptions nationwide. But what does that really translate to? So it means we've done a good job on getting people off of opioids and not prescribing as much. But the serious issue now is what we really need to do as an organization and healthcare providers is figure out a new solution and reevaluate how we're going to help people. So those that are not prescribing them are in a better spot, but what about those who are already affected by them? We're now pushing them out and they're still seeking these drugs.
That's a very interesting perspective, Shane. And one final question for you. Why are overdose deaths skyrocketing in minority and at-risk communities?
Right, well, they're targeting these communities because it's a lower cost drug. It's easier for people to get their hands on this. So it's absolutely terrible. It's devastating these communities. And, we're trying to do all we can. Part of this project, Project Opioid here in Broward County, is to make sure that we can educate and get into the communities. The only way to be successful is if we can share the stories, educate folks, really get out there and do everything, because it's not what's going on in the four walls here at Broward Health, but what's going on outside those four walls. So we're really stepping up to the plate, trying to do everything that we can for Project Opioid here in Broward County, and want to do more, so thank you.
Absolutely. Well, great information, Shane. Thank you so much for being here with us.
Thank you for having me.
Thank you so much to Shane Strum. What staggering comments. Hearing those numbers are staggering. We know that we've got to get more help for folks in need. And it's going to take leaders like Shane and his team to make Project Opioid work. So we're so privileged to have him. Next slide. So now let's get into some of the data. I'm excited to introduce you to Dr. Kendall Cordelew. She's a PhD Director of Data and Analytics for Project Opioid. She also works at the University of Central Florida doing data and analytics for that prestigious university. Kendall, can you hear me?
I can. Hi, Andrae. Thanks for having me.
Wonderful. I always got to check the audio here. Audio, this new technology, I'm still catching up since COVID began. But Kendall, let's go to the next slide, because I want to dive in now deeper to why are so many people dying of overdose. You hear these big number increases, 30, 40, 50%, depending on what exact community you live in South Florida or around Florida or really around America. And these numbers are staggering, Dr. Cordelew, because we already thought we had reached kind of an apex in 2018 and 2019 with this crisis. There was talk in 2018 and 2019 that the level of overdoses and deaths had kind of reached what we thought was a peak. The pandemic hits, and then suddenly now 30, 40, and 50% increases. Go to that next slide, and let's talk, why are so many people dying? Let's talk about the new data you have. And go ahead and dive into that next slide. I know you have some really, really, really good information. It's tragic, but it's good for leaders to know this. Are overdoses going up? Obviously they are. But what does the data say to you, Kendall?
So there's a couple of things, Andrae. I totally agree. I mean, it was back in 2017 when the opioid epidemic was declared a public health emergency. And to look at how the numbers have just grown exponentially since 2017, it's frightening to think of where we are and how we've gotten here. So what you're looking at here are the number of fatal drug overdoses in the state of Florida between 2015 and 2021. You can see we did make some headway, right, in early 2019, but then the pandemic hit. But more than anything, we've really just seen the impact that fentanyl has had on the overdose death rate in the state of Florida. As of 2020, Florida was number 2 in the country for the total number of overdose deaths, behind only California, which obviously has a much larger population. So, it's really a cause for concern in the state of Florida, and it's something that we've just seen grow over and over again. Between April 2020 and April 2021, there were 7,800 overdose deaths just in the state of Florida, which is about 170% increase from 2015. So we've really just seen the numbers grow exponentially in the state of Florida. And it's so easy to forget that each one of those numbers is a person. And as we get larger and larger, these percent increases just seem unfathomable, right? And we're really just seeing the numbers grow so quickly. So we
Got it.
also,
Next slide, please, Kendall.
Yeah.
So I think the question is, what does this increase in deaths look like over multiple years? Because as you were just saying, sometimes you look at the data and even as big as this 40% increase might be, that actually hides the fact that over 5 or 6 years, the increase is unconscionable.
Absolutely. And the same holds true when you look at Broward County. So if you look at Broward County's death rates from the last 6 years, 2015 to 2020, you can see we've continued this exponential growth. Broward County has gone up 139% overdose deaths since 2015. And so again, you can get lost in the numbers there, but you're going from roughly 320 people in 2015 to over 760 people in 2020. So that's a huge number of lives lost, lives that are, really in their prime. Often it's the working age, it's people that are in those important working years. And we've just seen such a dramatic increase in the last 6 years.
I want to reiterate for everyone out there right now something that you might be saying to yourself, I didn't hear that correctly earlier from both Rafael and Shane. And that is, despite these incredible increases in deaths in Broward County, around Florida, and around America, prescriptions for opioids and the distribution of prescription opioids are down 70% in 3 years.
Yeah.
Listen, we've all watched the movie Dope Sick. We're all aware of Purdue Pharma and the Sackler family and how they overprescribed and really were the catalyst to the beginning of this opioid crisis in America for a lot of years. But this is also unprecedented. I think we all believed that if we could pull prescription opioids back the way we have now, which, by the way, is a great thing if someone has never taken an opioid before. People that are opioid naive, keeping a first-time user away from opioids is such a great turn of events that's happened over the past 3 years. That being said, if you would have told any one of us that we would take 70% of the opioids out of the marketplace and then deaths would go up by 50%, I'm telling you, that is not something we expected. So you heard that right. And what that means, leaders, is that our strategies are going to have to be bigger than limiting prescriptions. And it also means that when we began as a society to limit prescriptions, the drug dealers and the drug cartels got really smart and they flooded the streets with the fake pills that you're going to hear about in just a minute. Next slide, please, Kendall.
I don't want to add that trend does hold true in Broward County as well. Their overdose or their prescribing rates for opioids has fallen from 51.3 to 35, and that's per 100,000 of the population. So Broward County is following that same trend as well.
Got it. So we hear about fentanyl, and I actually think fentanyl is very misunderstood. Even Shane was explaining it. He does such a great job, obviously, explaining it. But we really want you to understand what's happened and why these deaths have increased. And if you understand it as a leader, solutions, although not easy, become more clear. So, Kendall, when you look at this data, let's talk about, this is striking. Let's talk about how fentanyl has impacted deaths in Broward County just in the last 3 to 4 years.
Right. Yeah, this is, I think this chart really says so much, right? So I don't know how well y'all can see it on your screens, but the lines at the bottom, the pink line is prescription opioid deaths, and this is all in Broward County. Deaths attributable to prescription opioids. The gray line are deaths attributable to heroin, and then fentanyl is the red line. So you can clearly see that beginning in 2017, there was just an enormous spike in fentanyl deaths here in Broward County. And, it just really demonstrates how lethal this drug is. It's almost like we've got two opioid crisis, right? We've got the prescription drug crisis, which has been, we've really reduced the number of drugs that are being prescribed, but now fentanyl has infiltrated so much of the drug supply that it's really killing people at an exponential rate, much quicker than we would have ever predicted.
Kendall, leave this up for a minute. Go back just a second, because I want to, if you guys look at that in interim 2017, right, where you see where fentanyl is kind of sitting. Guys, this is what really happened. Everyone, please hear me and hear me well. You see heroin, prescription opioids. Those are those two lines that stay at the bottom. Prescription opioids are derived from a naturally originating substance, which is the opium poppy. Even though they're over a long period of time, they're processed and they become oxycodone, for one example. Its origination is in a natural plant, the opium poppy. When you look at heroin, although it's manipulated and very dangerous to someone who uses it, it originates with that same natural substance. When we start talking about fentanyl and you hear the word synthetic, what that means is that fentanyl is simply a chemical compound that has no origination in nature. So what the drug dealers figured out, if you look at 2017, you see that skyrocketing stock market like rise. Here's what happened. Drug dealers figured out it's dirt cheap to produce fentanyl. They could manipulate the substance in laboratories to make it more addictive, more powerful, and produce it for pennies on the dollar. You'll see later in the presentation that what's really happened is drug dealers and drug cartels are abandoning the production of heroin and regular cocaine and regular drugs. And inch by inch, you're seeing fentanyl replace everything. It's because it's powerful and it's profitable. And now almost everything you find on the streets is fentanyl. I'll go to that next slide, please. All right, so Kendall, talk a little bit, because this is, I think, again, where people get a misunderstanding. When we start seeing in these reports the mixing of drugs, the way I like to explain it is drug dealers are figuring out how to replace, which that replacement is a mixing, but it's really, again, fentanyl replacing and mixing with drugs. What's your data tell you?
So what was really interesting is, as I've said before, when I get line items of individuals that have died of a drug overdose, and it's so stark to look at those and consider that each one of those is a human life lost. But it's easy to see as I look at the 2015 data versus now, just how prolific fentanyl has become in the drug supply. So fentanyl, I was able to obtain some 2021 data from the Broward County Medical Examiner's Office. So I looked at that just to try to get an idea of what's going on in Broward County. So there were 374 total deaths. And again, this is all preliminary data. But of those, 292 of them were caused by fentanyl. And of those, 147 of them also had cocaine in their system, and 96 had morphine or heroin, which I can talk a little bit about that too, in their system. So what we're really looking at here is that the drug crisis has really evolved, and it's much more complicated than it was in 2015. In previous years, we did not see all of these different drugs being mixed into one person. I sum up all of the different drugs that are in someone's system, and sometimes there's 7, 8 different drugs mixed with fentanyl, alcohol, all kinds of things. And that is really a very stark difference from what we saw 5 or 6 years ago. I think it's also really important to point out, because a lot of people may not know this, but fentanyl alone is incredibly deadly. And I know Andre's going to talk about that more later. But when you mix fentanyl with other drugs like cocaine, it increases the potency of not just the fentanyl, but also the cocaine, making everything more deadly and making it the potential for overdose just so much higher. So that, I think this is an interesting nuance. And we've talked a lot about how the overdose crisis has changed. And I think this is one of the really important points that leaders need to understand, that it's really not as cut and dry as it once was. Now there's just a lot of nuances and a lot of differences in what we're seeing in the overdose deaths.
Next slide, please, Kendall. And again, so are people purposely taking fentanyl or taking it unknowingly? You can go to the next slide, Kendall. What we think is that both are true. And this is very, very important. And by the way, someone just asked if they can get a copy of the slide deck. We will get that to you for sure. Fentanyl, so a few things about fentanyl, and we're gonna move on from this part of the data presentation. Fentanyl is the most dangerous drug. You see the small amount of grains of fentanyl. Focus on the second. Look at the vial to your right. That's the amount of fentanyl that they're comparing to the equivalent powerful amount of heroin. This is an old photo. The new fentanyl analogs, because this is what you got to know. This fentanyl is being constantly manipulated in laboratories in China right now. And so this amount of fentanyl probably is only 50 to 25% as powerful as the fentanyl we see now. It is evolving almost on a monthly basis. Next slide, please, Kendall. And what people need to understand is this is the screenshot what you're seeing right now. What the drug dealers have figured out is as prescription pills are leaving the marketplace, which is a positive turn of events, much of the fentanyl now is coming in fake oxycodone, but also fake drugs like Adderall, Percocet, you name it. Drugs are being replaced constantly with fake drugs that are actually fentanyl. So next slide, please, Kendall. People need to know that this is something that has just happened. The DEA recently reported that as many as 2 of every 5 pills with a fentanyl that contain fentanyl have a lethal dose. So these are incredibly, incredibly dangerous. Next slide, please. Also, just the DEA recently talked about how many of these fake pills how they're increasing. You saw from 2019 to 2021 in one DEA survey, a 2.6 million pills seized, up to 9.6 million. So the drug cartels have figured out that this is the way to be profitable, and you're seeing it on a constant basis. Next slide, please. I want to show you guys, this is something fascinating. When you think about that small amount of fentanyl that could be fatal, this is a recent Vice News story of how fentanyl is being made outdoors in Mexico. And think about how small an amount of fentanyl can kill you. Look at this. Look at how this is made. One small amount of this fentanyl could be fatal. And what you're seeing now is because of how it's made and then pressed into these pills are incredibly, incredibly dangerous. And you're seeing this phenomenon being the backbone of this rise in deaths. Next slide, please. You can keep on going, Kendall. We'll go to the next slide. This is kind of talking a little bit about the rise in communities of color, rural communities continue to rise. Why don't more people reach out for help? Kendall, this is kind of the last data slide. Let's go to the next slide. What we're seeing is a tremendous increase in what we're seeing. We already passed that data slide, but here's what we saw. We saw, as Shane mentioned, as Rafael has mentioned, a tremendous increase in communities of color. The Black community, the Latino community have seen the highest increases, as well as a spike in a continued rise in rural communities. One of the things that Project Opioid has to be really cognizant of is how, like Rafael said, we reach neighborhoods where people already were underserved, and where maybe, Kendall, this is kind of the last question on this part of the presentation, there is a distrust for our hospitals, for government, for law enforcement, which keeps people from reaching out for help. What do we need to think about as far as not just having treatment available, but also for having that treatment accessible and for people being willing to take it if it's offered?
Yeah, absolutely. I think there's, historically, there are so many reasons why the minority community should have a distrust for the healthcare system, right? I mean, I think we can go back to, some terrible things that have been done, but I think there is a lot of progress. And what Project Opioid needs to do and what leaders need to do is really get to those individuals and where they work, where they worship, before they lose their social capital. We've got to change our messaging to really speak to these people that are at an increased risk for overdose. So I think it's so important that we reach out to people that have traditionally been disenfranchised with the healthcare system, that have valid reasons for being distrustful, and explain that there is help. There are FDA approved medications you can take. There is Narcan. There are things that you can do to protect yourselves and protect your loved ones. But it really comes down to the leaders, the grassroots people who are working in the communities, who have a way to speak with those individuals and really get the word out.
Got it. Let's go. Thank you, Kendall. Let's go to the next slide. We're going to keep this rolling because I'm going to just stop right now and just say, if you are watching this and you are absolutely just shocked by these numbers, you're shocked by the amount of people dying, that's why we wanted to put this up. There's not a lot of good news in this opioid crisis right now. There's good people working on this, but there's not a lot of good news. But with the leaders coming together, partnering with those who are already on the front lines working on this, we believe we can make a big impact. So take a moment right now, put your information in the chat. We've also got a survey we're going to send to everyone. We're going to put that in the chat. We're going to email that to everyone that's on today. And so we need you to get involved. Next slide, please. Keep entering your questions. So where do we go from here? Next slide, please. We really want to talk for just a second about Project Opioid's Overdose Initiative. Now, this is the model that we're seeing happen in Jacksonville, Orlando, Tampa. We're actually going to be doing this in 20 more communities in Florida and over 100 communities around America starting May the 19th, 2022. So next slide, please. What is the Overdose Initiative? The Overdose Initiative is really focused on Project Opioid's leaders coming together, aligning the providers, aligning those working on this to make sure when one person's in need, we can navigate them to help. Listen, how are we going to spend new money? Strategies for new resources. The state of Florida, yesterday we had Ashley Moody on, and she was talking about how $1.9 billion is coming from these opioid-centered lawsuits. What are we going to do with that money? Communities are going to get money. We got to spend that money properly and have community strategies. We got to look at data. Real-time data has to be provided. For example, the data on this presentation, brand new, 3 years ago, it wouldn't have been true that fentanyl, illicit fentanyl, is now causing 90% of the deaths. Someone in the chat was saying, hey, make sure to differentiate between pharmaceutical fentanyl and illicit fentanyl. You couldn't be more correct. When we look at the fentanyl that people are dying from, it is not the pharmaceutical drug that is used in hospitals. It is a dangerous, illicit, weaponized version of the same drug. People need to know that it is not prescription fentanyl killing anyone. Our data shows less than 1% of people are dying of prescription fentanyl. 90% of the deaths are fentanyl. 99% of the fentanyl deaths are that illicit fentanyl that you saw in the video. So we're gonna look at data and use it to provide real solutions, empower stakeholders, get the word out, do advocacy, and work with our elected leaders. We can work together as a community and save and transform lives. Next slide, please, Kendall. And ultimately, what does that look like in your community? So many of you, I think that you'll appreciate this. That looks like increasing naloxone, Narcan, medication-assisted treatment for those who need it. Guys, we cannot just tell people to suck it up and do better if they're struggling with these drugs. We have to give them FDA-approved medications. That's something we're going to continue to expand. Mental health services have to be available. The mental health crisis in this country, in your community, is driving this opioid crisis. We got to educate Gen Z and millennials on the new dangers of fentanyl and these fake pills. We have to empower leaders to solve the opioid crisis in their community. That's our goals. We're so excited that Broward's going to be able to save lives doing this. Next slide, please, Kendall. That's the Overdose Initiative. And so please fill out the survey. In this survey, I think we have 6 simple questions. Lisa wants to hear from you. She wants to hear about what role you could play in Project Opioid. Have you had a personal contact or connection to this crisis? Many people are on this webinar. Unfortunately, you've been impacted. You've lost a loved one. We want to hear your story. So please fill out your survey. We'll make sure you get it in email and in other forms. Next slide, please. So we also want to, keep going, Kendall. Next slide, please. Let's put Lisa's information up there. Screenshot this. This is Lisa's information. Please contact her. She wants to talk to you today. She's going to be leading, as Bob said. She's going to be your contact person. Bob's always available, but Lisa is going to be leading Project Opioid Broward. And so make sure you have her information. You're going to get this sent to you in an email as well. Next slide, please. So next slide, please. Thank you so much. So we would be remiss without telling a story. We're going to get you out of here in just a minute. But this is Tony and Alex. And Tony and Alex, I want to play just a small part of a testimony interview we did with Cheryl and Steve, who lost their 2 sons, respectively, to fentanyl in South Florida. And although they're not from South Florida, their kids were there. And Kendall, let's play just that snippet of the interview, because again, if you hear this all through just data, you miss what's really happening. Every increase, every number is a person's life.
It's a tough question, especially now. Holidays and moments in time are always really difficult for parents who lose children. Their gap is significant no matter how much time goes by. You eventually learn to find the joy in things that I say crowd out that little hole a little bit, but people need to know that that hole never goes away. And the frustration with the helplessness that's felt when you lose a child to an overdose or to mental illness. And you can't really talk about either one of those without connecting them to each other. We have to deal with both. But it's a helplessness. When your child is diagnosed or a loved one with another disease, there is a clarity of path. But in this scenario, when you have the overdose, the accessibility of drugs that can kill you, not just change how you feel, but can kill you, the need for more mental health providers, that helplessness adds a whole nother layer of frustration after the fact. And so, like Steve, we use those moments, no matter how hard they are emotionally, to connect to other people and ensure that we're doing the right thing. We're raising awareness. We're connecting people to providers. We're helping to break down the stigma, that people understand how pervasive this problem is, and implore our community stakeholders to step up and take action, because we both have to protect our loved ones and our family members and our kids, but we also have to take action to stop the flow. It has made the world so much more dangerous.
Steve, tough question, but same question to you and your family. I've met your family before, precious people. What's it like as a parent to lose a son, to lose a child?
Yeah, it's my greatest fear realized. As a parent, I always said, man, the worst thing that could ever happen to me is to lose a child, and it happened. And I agree with Cheryl. This time of year, his birthday, you don't feel like decorating the house. You don't feel like celebrating, but you've got a family to take care of here, and it's tough. And in hindsight, you look back and you say, how much did I not understand? What would I have done differently? And how can I advise others moving forward to recognize and take action and learn, not basically from our mistakes, but from what we experienced. And it's the most difficult thing in the world, quite honestly.
Guys, as we wrap up, and by the way, I'm so thankful that you guys would take a minute to share your stories. As we talked earlier, I just don't think that when we come together on these webinars or when we do convenings to talk about this overdose crisis, I just don't think we do it justice unless we have stories like yours, unless people hear about Alex and Tony and the thousands of other stories that we could tell here. I don't think the data tells the real story. The real story is what you guys are sharing today. Let me just ask you this final question, both of you. There are hundreds of leaders on this webinar, powerful people, business leaders, faith leaders, elected leaders from around the state, some people from around America. Cheryl, what would you say to leaders in light of losing your son about this fentanyl crisis, about this rising overdose crisis? What is your words to leaders about what we need to do to fix this?
It is time for change. It is time to step up to the plate and fill the gaps and build the bridges that provide people with appropriate information and the tools in their toolbox to help their loved ones, and in particular, our children. And that also means taking steps to protect our communities from the rampant availability of recreational drugs that are laced with fentanyl and other chemical substances that are killing our loved ones. And that when you think about those statistics, you need to think about the fact that those are real people. They're people's children, they're Tony, they're Alex, they're Steve and I. It can happen to anybody. And while we think that we're most empathetic with people like us, we have to stretch our empathy muscle and take action. A tough question.
So, Kendall, thank you so much. We wanted, again, just to take a second as we conclude the webinar. We've got 9 minutes left. Every time you see an increase in deaths, you see this data. It's so important. We have to make decisions based on data. Every part of this data is someone's life. It is a family grieving a loved one. And so we have to think about the human toll that this is absolutely taking on people's lives. And every single day, as we impact this crisis, we can, on the other side, save lives. Next slide, please, Kendall. So I'm going to answer a few questions. We want you to get involved with us today, but we've had some questions come in. I'm going to answer them. Number one, we had Suzanne Higgins, please talk about marijuana being laced with fentanyl. Listen, I know for some of you that there's a thought of, oh, listen, we don't want to get people into hysterics. We don't want to overblow this crisis. I'm telling you, I thought the same thing a year ago. 2 years ago, if I would have heard this presentation, and I am the head of Project Opioid, I would have thought, you know what, this drug crisis is terrible, but it's limited to the certain people in danger and others not being in danger. I'm telling you, fentanyl is making its way into everything. I had a young mother talk to me about her daughter who died in the last couple months, under 18 years old, because she went to a party, her daughter, and took what she thought was an Adderall. Someone had given her what she thought was the drug Adderall. It was a fake pill with fentanyl in it. They found her. She had expired the next day. This was not the crisis of 5 years ago. These pills were not on our streets the way they are now. And fentanyl, because it's so addictive, drug dealers have every incentive to put it everywhere that they can. So we are seeing it in marijuana. The reports on that are spotty, but we are seeing it happen. Law enforcement is confirming that. But here's what you need to know. Heroin and cocaine, real heroin and real cocaine, are largely disappearing in your community and in this country, and being replaced with some cocktail that's fueled by fentanyl. So that's a great point. Also, Danny Moran, Chief of EMS, thank you so much for your leadership. You're wanting to be a part of Project Opioid. Rosetta was asking, what is the impact of this on tourism, hospitality, our business community, our visitors, employers? Rosetta, this is the right question. Listen, overdose death in Broward County is now the #1 cause of death if you're 38, 35 years old or younger. #1 cause of death. If you're a business leader on here and your company is, employees, the average age of your employee is 35 years old, the #1 health crisis they face is overdose by fentanyl. So Rosetta, you couldn't be more right that we have to be thinking about how this impacts the business community and what we do about it. We have Jean is saying in the comments, yes, fentanyl is in all street substances in Broward County. She says, I work at an outpatient treatment program, and our clients share with us that fentanyl is mixed with everything in the community. Jean, thank you. Someone from the front lines kind of confirming that. And by the way, some of you might be saying, why would someone take fentanyl if knowingly, like Jean is working at an outpatient treatment center where people knowingly take fentanyl? I'll tell you this, and I think Jean would agree with this, that fentanyl is the most powerful drug we've ever seen. It has been, Harry Nelson, who's a friend of mine, who's the author of The United States of Opioids, a tremendous book on this crisis, buy it on Amazon today. But Harry says that leaders should start referring to fentanyl, the new illicit fentanyl, not the prescription drug created in 1960 by Janssen Pharmaceutica, illicit street fentanyl, the stuff that was created in that vat in Mexico, that a small speck of it can kill you. Leaders, Harry says, need to start referring to it as a weapon. It is not even a drug. It is a weaponized substance. And it has been manipulated just in the past few years to be the most powerful and addictive drug. And what someone who's struggling with drugs will tell you is it is the most, it is like, I read this, it is like a warm blanket. If you're in pain, this drug has been weaponized to take that pain away, but also put its hooks in you almost immediately. So we're seeing, we got to hear more from people like Jean, but she's confirming fentanyl is everywhere, and we have to be able to address that. So we have so many more questions, but a lot of them we're going to answer privately. Go to the next slide, please. I want you to know that I am available. Dr. Kendall Cordelue is available. Oh, sorry, this is the final slide. Lisa, I'm going to turn it back over to you. I know we have so many questions. Bob, I want to thank you again. You are an absolute rock star. Nothing happens in the community without you and the business force behind an issue. So thank you. Thank you to Rafael and the whole team at Florida Blue, all of the co-chairs, all of the leaders. But now that you've seen these numbers, this is the moment for your community's business, faith, philanthropy. That's what Project Opioid is all about. It's about the entire community coming next to those already working on this to have the resources, the strategies that ultimately save lives. Lisa's going to be leading this up. We're here and available to you. Lisa, I'm going to give you the last word on this important webinar.
I want to thank everyone so much for joining us today. I encourage everyone who is interested to get involved. I will answer each and every question that comes my way, and I will sign you up, and together we will make an impact on stopping the opioid and illicit fentanyl abuse and overdoses in Broward County. Thank you so much.
Thank you, everyone. Have a great afternoon.
Bye.
Thank you, Andrae. Thank you, Lisa.